Nearly 1 in 5 kids in America goes to bed hungry at night.
Now, to learn more about the growing epidemic, we recently traveled to Philadelphia, which has some of the highest rates of food hardship in the entire nation. We visited St. Christopher's Hospital, which has one of the most progressive programs from coast to coast.
We came home one day from school, the lights were off. My electric had got cut off. So when I first came home, I was really stressed out about it. But once I go pick them up, I have to show them that it's okay. We're going to get through this. Mommy's going to fix it. We're going to be all right.
Joanna is not alone. A recent study by the Census Bureau shows that 15% of the population is living in poverty. That is the highest number ever recorded, and it's led to what the experts no longer refer to as hunger, but food insecurity.
Over 17 million children were living in households that were food insecure, and it's even more devastating for the very young children. What are the consequences of that? Poor social, emotional, cognitive, and physical development of those children.
Dr. Mariana Chilton is one of the leading experts on hunger in America. 10 years ago, she helped start the GROW Clinic at St. Christopher's Hospital for children.
The fact that we have 1 in 5 children living in poverty today, I think should make all of us very upset, where we can say, okay, we've had enough. We want to learn about what the issues are, and we want to be able to be a part of the solution.
Here at the GROW Clinic, a child is first measured, then weighed.
You did great.
Next comes a meeting between the pediatrician and parents, followed by a consultation with other members of the team, including the doctor, nurse practitioner, nutritionist, psychologist, and social worker.
So you have the recommendations.
Told her no juice. She kind of knows why, because if you got something sweet, he's gonna want more of it.
Here, they will develop a plan to improve nutrition and to promote growth.
But the difficult thing is we really need to have the parents buy in. I know we can identify the issue, the medical issue, the psychosocial issue, but I can't do anything without the parent.
Ask you some questions about the different factors that affect Nevaeh's health and development.
Across the parking lot, St. Christopher's Hospital is the front line in the war on hunger. Inside the emergency room, Dr. Amanda Breen is collecting data for the research study called Children's Health Watch. The study looks at how food, energy, and housing insecurities affect the child's ability to develop.
Doctor, I've heard it described that down the hall you see the most vulnerable of the most vulnerable coming in here. Explain what that phrase means.
I mean, I think the people that we are seeing here in the emergency department are those people who are actively seeking help and who are struggling and whose children are struggling in terms of their health. So we see kids oftentimes who've been diagnosed with asthma, with anemia, with all of these sort of health conditions that affect sort of the rest of their development.
One of those mothers living with stress is Rosemary. Both she and her husband are unemployed. They have a small nest egg, but don't know how long it will last.
Are you worried it's going to last for a while, but it's not going to last forever?
No, we worry right now.
Yeah.
We worry right now. That's why I should start working like today, one day, 2 days, like that. So I have some daycare for the baby if I can be full-time in the grocery store.
Hi, my name is Tiana Gaines, and I'm a proud member of Witness to Hunger.
Tiana Gaines is a 32-year-old and the mother of 3. She and her husband admittedly struggle every day to keep food on the table. That's why she is a vocal member of Witness to Hunger, an organization whose members use first-hand photos to share experiences on raising a child on a limited income.
We don't want to hand out, we want to hand in. You know, it's really funny to me how people talk about their queens and, you know, fathers on welfare and families on welfare and how they don't want to get up and they don't want to do anything and they're lazy and they're this and they're that. But the programs that you're giving us, some of them do work. They do help those who want to be helped. Everybody isn't robbing the system. If that's the case, then I can ask them, how are you better than me when you're giving out handouts to GM? You're giving out handouts to oil companies, but you won't give a child enough food to eat at night?
Joanna Cruz has also been a member of Witnesses.
Personally, I need the resources, I need the skills to do this on my own. That's what I need. If it's a job offer, if it's free education, if it's gonna better me and help me to live and to deal and do this on my own, then I'm taking it. If it's a handout, I don't want it.
Back at the Grow Clinic, it's graduation day, one of the favorite moments for the staff. Today, Isabella Ortiz gets to celebrate. Her body mass index is getting close to normal.
You can see when she came in that her body mass index was below the 5th percentile for her age. But you can see that over time her body mass index has really improved, and now she's at the 38th percentile today.
Can you give me 5 at least? All right, good job.